Good afternoon. My name is Daniel Friedman, and I'm a product manager at Heartbeat Health. I'm also a medical student and business student at Columbia University. Heartbeat Health is a virtual cardiology company, and for the next 4 minutes, I'll take you through how we manage cardiovascular disease with a digital-first model. To set the scene, let's start with a sobering statistic. Someone in the US dies from heart disease every 37 seconds. That's the leading cause of death for women, men, and nearly every racial and ethnic group in the United States. It's a disease that spares few, killing well over 500,000 people each year and costing hundreds of billions of dollars in its wake. And here's the specific breakdown of where Heartbeat steps in. We manage patients with moderate and high-risk cardiovascular disease, focusing on the true clinical members of a population. Of these, 33% have moderate and high-risk heart disease and cost an additional $2,500 per year. Then we have the 6% who are the acute high utilizers, patients bouncing in and out of the hospital and costing about $30,000 per year. As a company, Heartbeat has 3 key differentiators. We're clinical first, founded by a cardiologist and built with actual clinical experience in patients from the ground up. We're scale-oriented with a national network across the US and now the largest national network of virtual cardiologists. And finally, we're focused on ROI, achieving better outcomes at lower cost for the populations we serve. We've memorialized some of these distinctions earlier this year when we won the contract to be the digital platform for the American College of Cardiology, the ACC, and their 28,000 cardiologists across the US. So our story. Heartbeat started in 2017, and we've seen rapid growth over the last 6 months as we closed our Series A with Optum Ventures and 406 Ventures, launched our app, and managed our 50,000th patient. So where is our sweet spot? Many existing digital health interventions focus on wellness and coaching, and we've taken on the higher risk category of real clinical management, which generates a much higher cost savings along with significant reduction in disease. Heartbeat has 2 programs. The first is called 100 Days of Heartbeat for the high-risk and post-hospitalization patients, those with heart failure, coronary disease, and arrhythmias. The second is called Heartbeat 365, which is our ongoing care program for the moderate and high-risk patients, those stabilized but with active cardiovascular disease. And this is how it works. We're a 2-sided app for providers and patients, and we bundle remote patient monitoring, telemedicine, cardiac rehab, and an analytics engine that supervises all clinical data. The provider side looks like this, with virtual queues, panel management, group engagement, and diagnostic tracking data. And the patient side is simple and easy to use. We track device data, allow interactions with care teams and your family support systems, and we provide straightforward communication and telemedicine. Care transitions happen seamlessly as patients begin a program of care in the hospital and then move to their home. I'd like to close by highlighting that we were evidence-based and outcome-driven. Shown here is a case study in which we focused on a post-hospitalization population of 8,000 patients. Using our digital-first care process, Heartbeat reduced ED visits and hospitalizations by 39%, compared to the prior benchmark and industry average of 8%. So that's Heartbeat. I would like to thank you for listening, and I welcome any questions.
Wonderful. Thank you, Daniel. And I think we have you on the line.
Hey, thanks so much for having me. Happy to be here
Hi.
today.
Great. So for anyone in the audience, if you'd like an introduction, fill out the poll. We do have a question that came in. Are you considering international markets?
So right now we are US focused, but heart disease is certainly a global issue. So I definitely see this as a direction we'd go in the future.
Wonderful. And we have another question. Is this a mobile only solution? Have you had any issue with older, more vulnerable populations not having a smartphone?
It's a great question. So right now we've started off mobile first with the rationale that most of the devices are more updated, more modern, and it gives us a little more control in the process. As for the older population and more vulnerable populations, that's definitely something we've thought a lot about. It hasn't shown to be a huge issue for us because So smartphone penetration throughout the country is actually extremely high, even among older populations and people with lower socioeconomic status. So far, this has not been a huge barrier for us. We've focused both on iOS and Android, so we really haven't limited ourselves with that respect.
Great. And are you currently raising?
We currently are not raising around. We closed our Series a few months back.
Great. And we have time for one more question. Do you have your own provider portal?
Yes, so actually there's an entire provider facing app, and that's how providers sort of engage with patients. It gives them an inside view of what's going on with their patients, and they can access the data both before the visit as well as during the visit. So we're making sure that data can be reviewed sort of at the point of care and these point of interactions with the patients to make it, if you're reviewing remote patient monitoring data, for example, you can really make that review process interactive with the patient.
Wonderful. Well, thank you, Daniel, for joining us. So we don't have time for any more questions today, but thank you again.
Thanks so much.